So last month, I put out a video about blood pressure meds and side effects in older people. And look, the comments they exploded. Over 400 of you wrote in. And you know what? Almost everyone was saying the exact same thing. My doctor says my pressure's too high, but honestly, I feel terrible on these pills. The numbers look great now, but I can barely stand up without getting dizzy. I'm 75 years old and they want me at 120/80, the same as my son who's 40. Does that actually make sense? And the answer is no, it doesn't make sense. And today I'm going to explain exactly why. Not with my opinion, okay? With actual science. Science that your doctor either hasn't read or, and I hate to say this, but it's true, has chosen to ignore because following committee guidelines is just easier than actually thinking about the person sitting right there in front of them. So today, every single thing I'm going to show you, every number, every demonstration, every research study I'm citing, it's all going to be right here on screen. No confusion about what's really happening in your body after 70 and what blood pressure numbers actually make sense at that age. Now, think about this for a second. Imagine 3 different patients walk into a clinic. First person, a 30-year-old marathon runner. Blood pressure, 140/90. Second person, 50-year-old guy who works in an office. Blood pressure, 140/90. Same number. Third person, a 78-year-old retired teacher. Blood pressure, also 140/90. Same exact numbers on the monitor. But here's the thing. Any doctor worth their degree should look at those 3 people and make 3 completely different decisions. Because even though the numbers are identical, the context is totally different. That's the whole point I'm trying to make here. Okay, so here's the mistake. And I'm not exaggerating when I say I see this every single day in practice. Patient over 70 comes in for a regular checkup. Blood pressure reads 145/88. Doctor pulls out the guideline chart, sees it's above 130/80, and boom, prescription written. Maybe it's a water pill, a diuretic. Maybe it's an ACE inhibitor, sometimes both. Patient goes home, starts taking the pills like they're supposed to. 2 weeks later, they're lightheaded, exhausted, and then one night, 2 a.m., and they get up to use the bathroom and they fall because their blood pressure dropped too low when they stood up. So they call the doctor's office. And you know what the office says? Oh, just keep taking it. Your body needs time to adjust. Months go by. Now the blood pressure is 118/76. Beautiful, right? Perfect on paper, but this person can't garden anymore. Can't even walk to the mailbox without feeling like they might pass out. Can't think clearly because, and this is the real problem, their brain isn't getting enough blood flow. They did everything right, followed the guidelines perfectly, took every pill exactly as prescribed, and their quality of life just collapsed. Why? Because everyone was so focused on treating the number on the chart. And the number on the chart? That's not the problem. The real problem is that we're using this one-size-fits-all target on a group of people whose cardiovascular system has fundamentally changed. So if you're over 70 and your doctor is pushing you down to 120/80 without even considering your individual situation, your blood vessels, your risk of falling, how your kidneys are doing, how you're feeling mentally, that's not good medicine. It's algorithm medicine, following a flowchart. And honestly, it can be dangerous. Today, I'm going to walk you through what actually happens to your blood vessels as you get older. Why higher blood pressure is often, and I know this sounds crazy, but why it's often necessary after 70, and what the actual research says when you actually sit down and read the full studies, not just the headlines. Oh, and hey, we're getting close to 200,000 subscribers on this channel. If you've ever watched one of my videos and thought, man, why didn't my doctor ever explain this to me? Do me a favor. Hit that subscribe button and like this video right now. I'm going to be straight with you about something. The pharmaceutical industry? They don't make money when you take fewer pills. They make money when you take more. This channel exists so that you have the information you need to actually have a real conversation with your doctor. Not just sit there and nod and take whatever prescription they hand you. All right, let's get into this. Why is a blood pressure of 145/88 not automatically dangerous in someone who's 75? Here's how I explain it to my patients. Think about a brand new garden hose. You just bought it from the hardware store. Inside, the walls are smooth, flexible, elastic. You turn on the water, and even with just a little bit of pressure, the water flows beautifully all the way to the end. No problem. Now fast forward 30 years. That same hose has been sitting outside, in the sun, through winters, through summers. The inside walls, they've got mineral deposits now. The rubber isn't flexible anymore. It's stiff. It's hard. Now, if you want the same amount of water to reach the end of that hose, you need more pressure. Not because high pressure is good for the hose, but because the condition of the hose requires it just to maintain the same flow. Your arteries are that hose. Over the years, over decades, the inner lining of your blood vessels, it's called the endothelium, it becomes less elastic. Calcium deposits start forming. The smooth muscle in the vessel walls gets stiffer. And look, this isn't some disease we're talking about. This is just aging. It's normal. It's a process called atherosclerosis. Now don't confuse that with atherosclerosis. That's the plaque buildup. What I'm talking about is structural stiffening of the arteries themselves. When your arteries are stiffer, your heart has to generate more pressure to push blood through the system and get it to your organs, especially your brain and your kidneys. Think about it. Your brain sits at the top of your body. Blood has to flow upward against gravity. If the pressure isn't high enough, less blood gets there. And a brain that's not getting enough blood, it doesn't work right. Here's something most people, and honestly, a lot of doctors, have never really thought through. Blood pressure isn't this independent risk factor that exists by itself. It's a marker. It's a data point. And you have to interpret it based on what it's trying to accomplish, which is getting adequate blood flow to your organs, especially your brain. Lowering the number just to lower the number? That's not the goal. Getting enough blood to your brain. That's the goal. And sometimes those two things are actually fighting against each other in an older person. Let me give you a number that always makes people stop and think. Your brain is about 2% of your total body weight, but it uses roughly 20% of all the blood your heart pumps every single minute. 20%. It is crazy dependent on consistent, adequate blood flow. In a younger person with nice flexible arteries, a blood pressure of 120/80 delivers that flow, no problem. But in a 75-year-old whose arteries are stiffer, you might need 140, maybe even 150 systolic just to deliver that same amount of flow to the brain. And here's what I see all the time in my practice. I guarantee your doctor has seen this too, they just haven't connected the dots. Patients over 70 who get aggressively treated down to 120/80, they start showing this pattern of symptoms within just a few weeks. First thing is orthostatic hypotension. That's the fancy medical term for your blood pressure dropping when you stand up. You've probably felt this before. You stand up too quick and suddenly you're dizzy, or you see stars for a second. In a young person, it's annoying for like 5 seconds. But in a 75-year-old who's on blood pressure medication, that's a fall waiting to happen. And falls in older adults, these are not minor things. You fracture your hip at 75? There's almost a 20% chance you're dead within a year. Let me say that again. 1 in 5 people over 75 who break a hip don't make it to the next year. So when we increase someone's fall risk by dropping their blood pressure too low, we're not helping them. We're hurting them. Second symptom, cognitive problems. Brain fog. Patients tell me, I just can't concentrate like I used to. I'm forgetting words. My memory feels off. This isn't dementia. This is the brain not getting enough blood flow. We call it hypoperfusion. The pressure isn't high enough to push adequate blood up to the brain, especially the front parts, and your ability to think clearly suffers. Third thing is fatigue. Just this deep, heavy tiredness that doesn't go away no matter how much you rest. Physical things that used to be easy now feel twice as hard. That's because your muscles, just like your brain, need blood flow. You reduce the pressure, you reduce the flow, and the muscles just can't perform. If you're sitting there watching this and you recognized yourself in any of that, stop for a second. Take this seriously, not to freak out, but as a reason to ask your doctor a very direct question. Could my blood pressure medication be causing these symptoms? And if your doctor just brushes that off without even considering it, you need a second opinion. Let me tell you about a patient I had named Richard. He was 73 when he first came to see me. His family brought him in because they were worried about his memory. He'd been forgetting conversations, repeating himself, just seemed mentally slower than he'd been a year before. His regular doctor had started him on 2 different blood pressure medications about 6 months earlier. His pressure had been 148/90 at a checkup, and the goal was to get him under 130 per the guidelines. When I checked his blood pressure in my office, sitting down, it was 116/72. Looks perfect, right? But then I had him stand up, and standing it dropped to 98/64. That's a drop of 18 points. That's orthostatic hypotension. When I asked him directly, he admitted he'd been feeling lightheaded a few times getting out of bed in the morning. Also, he was completely exhausted by early afternoon. And he'd stopped going to his weekly chess club because he just couldn't focus on the games anymore. So I called his primary care doctor. We talked it through. We both agreed to taper one of the medications and cut the dose on the other one. 3 weeks later, Richard's family called me. His energy was back. The lightheadedness was gone. And his memory? It was sharper. Not perfect. I mean, he was still 73, but he was functional again. His blood pressure settled around 138/84, higher than the guideline, lower than where he started. And he was living better. That is what personalized blood pressure management looks like in a real person over 70. So why does this happen? Why is the standard target wrong for so many older people? The answer is in the research, and it's in the anatomy. Let me start with the research. In 2015, there was this huge study called the SPRINT trial. Made massive headlines. It showed that intensive blood pressure control, getting people below 120 systolic, reduced heart attacks and strokes compared to standard control, which was below 140. The media ran with it. Guidelines changed overnight. Doctors everywhere started treating more aggressively. But here's what almost nobody read, including most doctors. The SPRINT trial excluded adults over 80. It also excluded anyone with diabetes, anyone who'd had a stroke before, anyone who was frail. In other words, it excluded exactly the kinds of patients we're talking about. The complex, older, multiple health problem adults who make up most people over 70. There's another study, much less famous, that looked specifically at people over 80. It's called the HIVET trial. And this one showed that yes, treating very high blood pressure, like above 160, that helped. But pushing it below 150? No benefit. In fact, some observational data in the very old suggests that blood pressure below 140 is actually associated with higher death rates. Not lower, higher. Why? Because those patients are falling. They're breaking hips. They're not getting enough blood to their kidneys and brains. The medication is causing more harm than a slightly elevated blood pressure ever would have. Now let's talk about what's actually happening in your body anatomically, because this is where everything clicks into place. Your blood vessels have 3 layers. The innermost layer is called the tunica intima. It's this single-cell thick lining called the endothelium. It's smooth, and it releases substances that help regulate blood flow and prevent clots. The middle layer, the tunica media, is made of smooth muscle and elastic fibers. This is what lets the artery expand and contract with each heartbeat. The outer layer, tunica adventitia, is just connective tissue holding everything together. As you age, a bunch of things happen to these layers. The endothelium doesn't work as well. It produces less of this molecule called nitric oxide, which keeps vessels open and flexible. The smooth muscle in the middle layer gets infiltrated with collagen and calcium. The elastic fibers, they're made of a protein called elastin. They break down and get replaced with stiffer collagen. The result? The artery that used to expand easily with each pulse of blood now resists. It's stiff. We can actually measure this clinically. It's called pulse wave velocity. The faster the pulse wave travels through your arteries, the stiffer they are. Do you understand what that means functionally? When your heart pumps blood into a stiff aorta, the aorta doesn't absorb the pressure by expanding like it did when you were 30. Instead, the pressure just shoots up. That's why systolic blood pressure, the top number, tends to go up with age even if the bottom number, diastolic, stays the same or even drops. It's not that your heart is working harder necessarily. It's that the vessels can't buffer the pressure anymore. Now here's the key thing. Blood flow to your brain depends on what we call cerebral perfusion pressure. That's basically the difference between the pressure pushing blood into the brain, which is your blood pressure, and the pressure pushing back, which is the pressure inside your skull. For most people, the pressure inside the skull is low and stable. So brain blood flow is mostly just determined by your blood pressure. If your arteries are stiff and you artificially lower your blood pressure with medication, cerebral perfusion pressure drops. Blood flow to the brain decreases, and your ability to think clearly declines. This is not just theory. We can measure this. Studies using special ultrasound on the brain have shown that older adults on aggressive blood pressure treatment have lower blood flow velocity in their brain arteries compared to people with slightly higher pressures. Lower flow means less oxygen. Less oxygen means worse brain function. Okay, before I get to what you should actually do about this, I need to address something important. Some people are going to hear this information and think, okay, higher blood pressure is fine, I'm going to stop all my meds. Do not do that. Do not stop your blood pressure medication suddenly without talking to your doctor, especially beta blockers. Stopping those suddenly can cause your blood pressure to spike dangerously and even trigger a heart attack. The goal here is not uncontrolled high blood pressure. The goal is appropriately managed blood pressure for your age and your specific condition. Here's the framework I use with my patients over 70. First, we define what too high actually means for them as an individual. If you're 75, you have no history of stroke, no heart failure, your kidneys are working okay, a systolic blood pressure of 140 to 150 is not dangerous. In fact, it might be optimal. The evidence supports a target of less than 150 systolic in most adults over 75, not less than 120. Second, we assess for symptoms of overtreatment. Are you dizzy when you stand up? Are you tired all the time? Is your thinking foggier than it used to be? Are you falling or almost falling? Those symptoms matter way more than the number on the blood pressure cuff. Third, we measure what's called orthostatic blood pressure. That means we check your pressure lying down, then sitting, then standing. If your pressure standing is more than 20 points lower than sitting, that's orthostatic hypotension. And that's a huge red flag that your medications need to be adjusted. Fourth, we look at your overall functional status. Are you robust? Active? Going for walks every day? Then maybe we can aim a little lower. Are you frail with multiple health problems? Then we aim higher. We prioritize preventing falls and keeping you functional over hitting some arbitrary number. Now, let's talk about what you can actually do beyond just adjusting medications. Because there are real interventions that improve the health of your blood vessels, not just mask the number. First one is endothelial function training. Remember that inner lining of your arteries, the endothelium? It responds to physical stress by making nitric oxide. Nitric oxide dilates blood vessels and improves their flexibility. The way you stimulate this is through brief, repeated periods of increased blood flow. The most effective method is something called flow-mediated dilation training. Here's how it works. You temporarily restrict blood flow to an arm or leg, then you release it. The sudden rush of blood returning stimulates the cells in the endothelium to release nitric oxide. Over time, this improves the function of your endothelium everywhere in your body, not just where you're training. Exercise 1. Arm blood flow training. Sit down in a chair with good back support. Grab a blood pressure cuff and put it on your upper arm, same position as if you were taking your blood pressure. Now inflate the cuff to about 200 millimeters of mercury, or just until you feel firm pressure, but not pain. This restricts blood flow to your forearm. Hold this for exactly 3 minutes. You're going to feel some tingling, maybe slight discomfort. That's totally normal. After 3 minutes, release the cuff completely. You'll feel this warm rush of blood flowing back into your forearm. That rush, that's what stimulates the nitric oxide production. Rest for 5 minutes. Then repeat on the other arm. Do this whole sequence 3 times per week. Studies have shown this type of training improves flow-mediated dilation, which is a marker of how healthy your endothelium is, by up to 30% in older adults after just 4 weeks. I'm going to show you exactly what this looks like so you can see the timing and how much pressure to use. Exercise 2. Rhythmic breathing for autonomic balance. Your blood pressure isn't just controlled by your blood vessels. It's also controlled by your autonomic nervous system. That's the part of your nervous system that runs automatically without you thinking about it. The sympathetic branch raises blood pressure. The parasympathetic branch lowers it. Most older adults have what we call sympathetic dominance. Their system is stuck in a higher pressure state. You can actually shift this balance with controlled breathing. Sit down or lie down, whatever's comfortable. Breathe in slowly through your nose for a count of 4. Hold it for a count of 4. Then breathe out slowly through your mouth for a count of 6. The exhale is longer than the inhale. That's the critical part. A longer exhale stimulates the vagus nerve, which is the main parasympathetic nerve. And this naturally lowers blood pressure without any medication. Do this for 10 minutes every morning and every evening. Patients who do this consistently often see their systolic pressure drop by 5 to 10 points within 2 weeks. And bonus, it comes with improved heart rate variability, which is a marker of how resilient your cardiovascular system is. Exercise 3. Calf muscle activation to prevent dizziness when standing. If you're getting dizzy when you stand up, it's because your body's compensatory mechanisms aren't kicking in fast enough. One big reason is something called venous pooling. When you stand, blood pools in the veins in your legs because of gravity. It takes a moment for your heart rate and blood vessel tone to adjust and push that blood back up. You can prevent this by activating your calf muscles before you even stand up. While you're still sitting, pull your toes toward your shins. Hold that for 3 seconds. Do it 5 times. This contracts your calf muscles, and they act like a pump, squeezing blood out of your legs and back toward your heart. Then when you stand, do it slowly. Take a full 3 seconds to go from sitting to standing. Give your body time to adjust. This simple technique can reduce orthostatic blood pressure drops by 40% or more. I show this to every patient over 70 who tells me they get dizzy, and it works like a charm. One more thing before I wrap this up, and it's really important. Age matters enormously here. If you're 55 and your blood pressure is 150/95, yeah, that needs to be addressed. Your blood vessels are still relatively healthy at that age, and sustained high pressure will cause damage over time. But if you're 78 and your pressure is 150/88, that's a completely different story. Your vessels have already stiffened. The changes have already happened. It's structural aging, not damage from high blood pressure. And aggressively lowering your pressure at that point can actually do more harm than good. So here's my question for you. How old are you? Leave your age in the comments, because it genuinely changes what I would tell you to focus on, and it helps me understand who's watching so I can make content that's actually relevant to you. Alright, here's what you need to take away from this video. If you're over 70, a blood pressure of 140 to 150 systolic is not dangerous in most cases. It may actually be necessary to keep enough blood flowing to your brain and kidneys. The one-size-fits-all target of 120/80 came from studies that specifically excluded older, complex patients, the exact people it's now being applied to. The real risks you need to watch out for are symptoms of overtreatment, dizziness when you stand, mental fog, constant fatigue, and falls. Here's your daily protocol. Check your blood pressure lying down, sitting, and standing. Write down the difference. If your standing pressure drops more than 20 points, you need to talk to your doctor about adjusting your meds. Do the flow-mediated dilation training 3 times a week. Do the rhythmic breathing, 4 seconds in, 4 seconds hold, 6 seconds out for 10 minutes twice a day. And activate your calf muscles before you stand up to prevent blood from pooling in your legs. Do this consistently. Pay attention to how you feel, not just what the numbers say. And have an actual informed conversation with your doctor. You're not just supposed to sit there and do whatever they say. You're an active participant in your own healthcare. I'm Dr. Nathan Brooks. This channel is where I tell you the truth. The medical system makes money from prescriptions and procedures. It does not make money from you being educated and empowered. Remember that. If this video gave you information your own doctor never told you, hit that subscribe button and smash the like button right now. Let's get to 200,000 together.